Understanding Behaviors and Communication for Persons with Alzheimer's, presented by Emily and Jessica, 2016.
What is Alzheimer's? It is not considered a normal part of aging, and Alzheimer's adds challenges to the aging process because it affects the person's ability to communicate, reason, and remember. Alzheimer's represents a progressive loss of intellectual functions and memories, and is more common in elderly women over the age of 80.
It can be caused by many other disorders, and is characterized by intellectual deterioration which occurs in a clear state of consciousness and which is severe enough to interfere with social or occupational functioning. One of the first signs of dementia is poor recent memory retention, which progresses to decline in a long-term memory. The effects on the brain. Alzheimer's disease leads to nerve, cell, and tissue death or loss throughout the brain. Over time, the brain shrinks dramatically in size, affecting nearly all of its functions. In the Alzheimer's brain, the cortex shows up, damaging areas involving in thinking, planning, and remembering. Shrinkage of the hippocampus is severe because it is an area of the cortex that plays a key role in the formation of new memories. The fluid-filled spaces within the brain, also known as the ventricles, grow larger.
We can also see the terrible effects of Alzheimer's diseases when we look at the brain tissues under a microscope. The Alzheimer's tissue has fewer nerve cells and synapses than a healthier brain. Plaque builds up between nerve cells. Dead and dying nerve cells contain tangles. Scientists are not absolutely sure what causes the cells to die and the loss of tissues in the Alzheimer's brain, but plaques and tangles are the prime suspect. Plaques is a buildup of protein. The clusters stop the transfer of signals to one cell to the other. The stages of Alzheimer's and understanding behaviors. Early stage may include the following: forgetfulness of recent events, denial or forgetfulness, social withdrawal, shorter attention span, difficulty with new learning, poor judgment, less able to make decisions. Signs of depression including poor sleep and physical complaints, loss of ability to do complex and familiar tasks, daily activities. A client with mild dementia is usually cared for at home until symptoms become severe. Clients with dementia may live with family members or may live alone in their own home and get support from family members or home care workers. Clients with dementia often need help getting organized, solving simple problems, and remembering important dates, such as appointments, occasions, and medications. A person with dementia will need support and supervision. For example, they may want to cook something on the stove and forget that they need to watch it, and it could burn. Just make sure you are there to supervise while supporting the person to be as independent as possible. A person with stage 1 dementia will usually be aware of the diagnosis and will be able to participate in decisions affecting future care. The middle stages: further loss of memory, confusion about time and place, inability to start or complete familiar activities, personality changes, restlessness, difficulty in recognizing others or self, particularly by name, reasoning, judgment, and problems with perception. A client with moderate Alzheimer's, further decline occurs in the client's mental and physical abilities at this stage. Memory will continue to deteriorate as the client forgets personal history and no longer recognizes family and friends. Some clients become restless and pace constantly or may wander off. A client may react in a number of ways in response to the loss of ability. An example may be the person may become less involved in activities or may repeat the same action or words over and over again. As the client dementia progresses, the need for assistance increases. The client may be unable to tolerate wearing dentures or eyeglasses, which can increase the risk for injuries. Increased confusion and disorientation to time and place will also necessitate assistance with activities of daily living, such as dressing, bathing, and using the toilet.
Extreme dependence on others for care and safety, inability to name family members and friends, extreme confusion, loss of ability to speak, inability to process information, severe speaking difficulties, severe disorientation to time, place, and people, possible seizures, constant state of confusion and inability to recognize self, family members, or others, total dependence on others for all activities of daily living, total urinary and fecal incontinence, inability to swallow, increased risk of choking and aspiration, coma, and death. In this late stage, the client is incapable of remembering, communicating, or performing self-care. Care is required 24 hours a day, and eventually the client will become bedridden, have difficulty eating or swallowing, and lose control of bodily functions. Unfortunately, this stage eventually ends with the client's death from secondary complications such as pneumonia.
What is communication? Communication is the exchange of message or information between the sender and receiver. Effective communication is based on sharing, understanding, and acceptance of beliefs, values, and experiences between the sender and receiver. How do we communicate? There are two forms of communication, which are verbal and nonverbal. Verbal is the use of words to transmit meaning. Nonverbal includes how we sound and how we express ourselves through our gestures and body language.
How to better communicate with someone with Alzheimer's. The environment. Communication is always easier if other things are not happening at the same time. Keep the environment calm and quiet, and turn off distractions like radios and TVs. Getting their attention. Approach the person slowly and always from the front. Touch their hands or arms gently, if appropriate, to help get their attention, and don't start talking until you know they are ready to listen. Eye contact. Face or sit in front of them and keep eye contact. This makes it easier for the person to understand what you are saying. Introduce yourself. Hello, I'm Jessica. I am your helper today. Use simple words and short sentences and speak clearly and slowly. Repeat important information. If the person hasn't understood the message the first time, repeat it using the same words. Show and talk. It's very useful to show them what you mean as well as tell them. For example, if it's time to wash the hair, have the shampoo and towel ready in hand. Pay attention to their reactions. The reactions to what you say can give you some idea of how much they understood. Pay attention to the expressions on their faces and respond to their moods and feelings. Keep the conversation simple. Give one message at a time and do not include too many thoughts or ideas at once, and don't give too many choices. Questions that can be answered with a yes or a no are much easier than open-ended questions.